Hello, welcome to our Sleep and Dreams final outreach project. My name is Cam. This is
William. So we'll start the project by reviewing some sleep cycle basics. So essentially, we all know that sleep is our restorative process, and we know that it's very important for physical and mental health. And the circadian rhythm is essentially what regulates the timing of sleep and wakefulness, which is aligned with the 24-hour day. And disruptions to this rhythm can impair sleep quality and overall health. And one thing to note is that the sleep cycle fluctuates through light and deep sleep, which I'll go into next, and that allows for the regulation of different processes. So the first one is NREM, and there's two main stages of sleep where there's non-rapid eye movement and rapid eye movement. And the three stages is what we transition through a normal sleep cycle, with N1 and N2 being the more light ones, and N3 being true deep sleep. So this is where all of the cellular repair happens along with growth. And N3 is the stage that actually allows for you to rest well and for repair to happen. And the second stage is REM, rapid eye movement. And as you can see here in the picture on the right, where we see a girl dreaming about her cat, this happens in REM sleep. So dreaming happens in REM sleep, and this is when the brain is highly active, and the brain waves are almost similar to wakefulness. And sleep cycles repeat every 90 minutes, which alternates between NREM and REM. And basically, without REM, we wouldn't be able to consolidate memories and learning. So, if you're a student and you're studying for tests, it's really important to have full sleep cycles so that you can consolidate what you learn and remember what you learn for your test through REM sleep. And another thing is sleep debt. And sleep debt essentially accumulates when we get less sleep than needed. And this can impair many things, both psychologically, physically, and physiology, where it impairs your function, mood, and even overall health. And sleep debt actually can increase the risk of many important health diseases like health disease, heart disease, diabetes, and even mental health. And studies have shown that insufficient sleep can severely affect cognitive function as well, which we'll go into next. These can range from memory to attention to even reaction time. So, as we said in the class motto, we know that drowsiness is red alert. But to emphasize this point, we dedicate a whole slide to it, saying that sleep deprivation is very dangerous. And in fact, drowsy driving is even as dangerous as drunk driving sometimes, because sleep deprived individuals exhibit impairments such as delayed reaction time, slowed reaction, physical reaction, and even reduced alertness. And in addition to this, it also has emotional, cognitive, and various physical impairments that all can take place due to slow sleep debt, and which means that when you're driving on the road or taking part of operating like heavy machinery, sleep deprived individuals is quite dangerous and very similar to drunk or even intoxicated operation.
so the third topic we talked about in class are common sleep disorders. So the first one is insomnia. This is the most kind of common one that we hear a lot about. It's the trouble falling asleep or staying asleep that result in some form of daytime impairment. It's promoted by three types of factors: predisposing factors, precipitating factors, and perpetuating factors. However, it is very treatable, and cognitive behavioral therapy should be the mainstay treatment for insomnia. The second sleep disorder that we talk about is obstructive sleep apnea, or OSA. So OSA is when you experience intermittent pauses or difficulty breathing while sleeping due to blockage in your throat. This is because your brain prioritizes sleeping over breathing. OSA independently is a cardiovascular disorder and should be treated. It's perfectly treatable and curable through a number of methods, including conservative treatments like weight loss or just trying out different sleep positions, CPAP, surgery, or dental practices. The third sleeping disorder we talk about is narcolepsy. The symptoms are chest, so cataplexy, hypnagogic hallucinations, excessive daytime sleepiness, sleep paralysis, and sleep attacks. So this essentially means that your body sometimes is unable to differentiate whether you're awake or asleep. And the fourth and final sleep order is restless leg syndrome. This is an urge to move during periods of rest or inactivity. It's an uncomfortable or unpleasant sensation that's kind of tingling in the legs when you're at rest. Both of the symptoms, which can be relieved by movement as long as the activity continues. And so, if you're experiencing this, you might be experiencing some level of restless leg syndrome. Okay, and now we're going to talk about some misconceptions about sleep that we talked about in class. Number one, the myth is that if you fall asleep in class, it's because you're bored. But the reality is the monotony of class only unmasks existing sleepiness. It does not create sleepiness. Second, the myth is that you can catch up on sleep on weekends. The reality is that sleep debt cannot be fully repaid in one weekend because your circadian rhythm is likely already disrupted. Third myth is that snoring is harmless. However, we learned in the OSA lecture that this might be a sign of obstructive sleep apnea, which is, as you know, is incredibly dangerous. The fourth and final sleep we also talked about is that alcohol helps you sleep better. The reality is that alcohol might induce sleep at first, but it disrupts REM sleep. So the girl with the cat that we talked about earlier, which would lead to poorer overall sleep quality. And so let's just review the factors affecting sleep. There are three things that we just need to really focus on. Number one is that blue light exposure delays melatonin production, which means that it delays sleep. So, as much as you can, reduce blue light exposure as you get closer to sleeping time. Number two is that increased cortisol levels via stress or anxiety can interfere with the ability to fall asleep. So, do whatever you can to reduce sleep, stress, and anxiety in your life, even though that's way easier said than done. And third is that poor sleep hygiene can disrupt sleep patterns. This means irregular sleep schedules like napping too much during the day, caffeine intake, or the diet.
And now we'll talk about an additional feature, which is the role of sleep in exercise performance.
So sleep is really important, especially in exercise performance, because with the growth hormone release, it is because it allows growth hormones to be released, which is necessary for muscle recovery and repair. It allows for glycogen replenishment, which is necessary for energy restoration. It allows for cognitive function and focus during workouts and motivation and general mood regulation. It's already hard enough to get to the gym. You don't need to be really dreading it.
Right. So if you're trying to get big and you're trying to lift huge, we're trying to emphasize that sleep is very important for that to happen. And here's a video of what happens when you don't sleep enough and you try to get big. See, my friend here is a perfectly healthy 21-year-old male. And in this video, he's clearly struggling to bench even 135 pounds. And the reason being is because he goes to sleep every day at 5 a.m. after and having poor sleep hygiene. And this is what happens if you don't sleep enough and you try to work out.
Oh, sorry.
Drowsiness is red alert.
Thank you for listening. Cool.
Slay.